Good afternoon and welcome to the 4th annual Islip Goes Purple event right here in the town of Islip. And I'd like to ask everyone if we could just pause for a moment of silence in memory of all those lives lost. Thank you. I'd like to begin today recognizing some of our distinguished guests. I mean, all of you are distinguished, and we thank you for being here and participating today. We have many, many elected officials, community leaders who have taken the time to join us today. And let me begin with Congressman Angie Garberino. If you just give everybody a little wave so they know where you are. And we're so delighted that Nassau County is in the house. Let's hear for Assemblyman Mike Durso from Massapequa Park. And representing New York State Attorney General, we have T.J. Hatter. From the town of Islip, our town board, our senior town board member, someone who served our country so well, Councilman John Cochran. Also, I want to introduce Councilwoman Mary Kate Mullen, who's also the town board's liaison to our Town of Islip Substance Abuse and Opioid Task Force, and she's been so diligent over these past couple of years on that task force. Mary Kate, thank you so much for your service. Likewise, someone who has been steadfast in our fight here, Town of Islip Councilman Jim O'Connor. And new to our town board, but equally committed to the cause, Town of Islip Councilman Jorge Guadron. Our Islip Town Clerk, Olga Murray. Islip Town Receiver of Taxes, Andy Whitman. And we've gotten, a commitment to the cause from so many people, but we were so really delighted to have county-wide participation and buy-in. And first, representing the Suffolk County District Attorney Ray Tierney is Assistant DA from the Narcotics Division, Dana Grimeau. And also from the Suffolk County Sheriff's Office, Errol Toulon, Under Sheriff Michael Kotusko. So many towns have joined the effort this year, and from the good town, can I say great town of Brookhaven? It's a great town of Islip. It's the almost great town of Brookhaven. Where is he? A really good friend, Councilman Neil Foley. And we have so many joint kind of initiatives, especially with Neil being on the westernmost part of the town of Brookhaven. So we thank you, Neil. Also from the east end of our town, likewise, Supervisor Rich Schaefer unfortunately couldn't be here, but sent 2 of his stars to join us today, and that's Councilman Terrence McSweeney and Councilman Dwayne Gregory. From YES, Youth Enrichment Services, and she is the co-chair of our Substance Abuse Task Force, and that's Mary Ann Pfeiffer, the Executive Director of YES. And if we ever need anyone to help out with anything, Mary Ann is always at the ready. And working in conjunction with Mary Ann and so many youth initiatives in our town, our Executive Director of the Youth Bureau, Tim Mayer. And from the JK Foundation, Kathy Konisdorf, who is the founder. Kathy will say a few words later. And again, our school districts, this is so important. It covers all spectrums. We have to get everyone involved, and no better than at the school level. So we're delighted that Brentwood has always been there, and the Superintendent of Schools, Rich Losner, and Hassan Ahmad, who is a member of the Brentwood School Board. From West Islip Schools, brand new superintendent, new to the town of Islip, but has thrown himself into everything right away, and that's Dr. Paul Romanelli. Again, we're blessed with so many assets in our town, and to have 2 incredible healthcare institutions We have from Northwell, Mike Scarpelli, the director of South Oaks Hospital. And from Good Samaritan Hospital, Dr. Louis Titelbaum, and also Justin Jason, who again is someone, no matter what we need, we just call Justin and he's there at the ready. So thank you, Good Samaritan Hospital. So again, we've gone through all spectrums of the community in trying to get the word out, and the business community embraced the concept in the very, very beginning. And we have representatives from some of the chambers. They were not all able to be here. From the Islip Chamber of Commerce, Liz Mayotte. From the Brentwood Chamber of Commerce, Bruce Fabrizio. From the West Islip Chamber of Commerce, we have Brad Wilson and Rich Carpenter. And also from Fidelis Care, we have John Franco. And if I've forgotten anyone, I apologize, and I just thank everyone for your patience through that long list. And I'm looking out at our commissioners. You know, this couldn't have happened today without the help and participation of the Department of Parks and Public Works. So we have Tom Owens, Deirdre Wahlberg, our public safety guys led off the Wren. You did a great job. Tony Prudenti, Rich Bastides, Dominic, you guys are terrific. So today is a very significant and meaningful day for our community. September 1st marks the town's annual Islip Goes Purple kickoff, where we turn our communities purple for the month of September for recovery. Today, September 1st, 2022, marks our 4th year that Islip has gone purple. This initiative symbolizes our continued commitment to stand together, united, in memory of the lives lost, those in recovery, those struggling, and the families throughout the town suffering from mental illness, struggling with mental health, and those affected by substance abuse disorder. And it doesn't discriminate. It can affect anyone, regardless of economic or social status. Even before COVID, the town has been steadfast. We formed the Town of Islip Task Force in 2018. And according to an article which you may have read recently in Newsday by Dr. Jeff Reynolds, national surveys have found that half of those who experience mental illness will also develop a substance abuse disorder and vice versa. 60% of young people in community-based addiction treatment programs meet the diagnostic criteria for another mental illness. Most behavioral health professionals believe the numbers of people struggling with a simultaneous mental illness and substance abuse disorder to be even higher, especially post-COVID, when anxiety and depression skyrocketed and drug and alcohol use soared and fatal overdoses jumped a staggering 30%. Thankfully, fatalities are coming down, in part due to the widespread distribution of testing strips along with expanded treatment. Enhanced efforts have saved countless of lives, but we are still losing 300 Americans per day, about 12 people every hour to overdose. And in suicides and the deaths of despair grow. For the last 3 years, our community members, business owners, community partners have been pivotal in the success of Islip Goes Purple, which is one way we can come together as a community. And this effort has grown throughout Nassau and Suffolk counties, with Brookhaven, Babylon, and Huntington following the Town of Islip and lighting their communities purple, along with Massapequa Park in the Town of Oyster Bay. Having elected officials from federal, state, and county levels joining with us here today is testament to the fact that substance abuse disorders, mental illness, and caring for one's own mental health are issues at the forefront that we must address as elected officials and that we're willing to tackle. These tragedies don't happen to other people, they happen to people like us. All of us have been touched in some way by loss due to overdose or suicide. We're making strides, but we have more work to do. And I'd like to introduce some of our speakers that we have here today. And I'd like to begin and ask Congressman Angie Garberino, who's our federal representative, maybe to speak on behalf of all of the elected officials here and share some thoughts with us. Andrew?
Thank you, Supervisor Carpenter. And first off, thank you for inviting me to speak today, and thank you for what Islip and the task force has done to help fight back this opioid epidemic. As you heard from the supervisor, this epidemic it doesn't discriminate. I'm sure everybody here knows at least one person that's been affected by it, which is why we have to be united as government. All my colleagues in government are here. There are people from the town, the county, the state. I represent the federal government. We all need to be united to fight against this epidemic. In Congress, my last 2 years down there, we have spent a lot of time fighting to keep drugs from pouring over our southern border. Fentanyl and opioids are coming over in large amounts, and we've done a lot to combat that. We've also done a lot. We just passed grants that will come back to the towns and the counties and the states to help both with opioid treatment and education. So this is very important, but our job's not done. Us elected officials all have to work together to continue to fight this. You have my word, Supervisor. As long as I'm in Congress, I'm going to fight to make sure that money is returned home for treatment, for education, just so you can continue to do the good work here in Islip and on all of Long Island. So thank you so much for having me today, and I'm so happy to partner with in this. Thank you.
Thank you, thank you, Congressman Garberino. We thank you for your steadfast commitment to deliver for us here in the town and across the island, really. Now I'd like to invite from Good Samaritan Hospital and member of Catholic Health, Dr. Louis Teitelbaum.
Okay. My name is Louis Teitelbaum. I'm an emergency room psychiatrist. I've been practicing on Long Island for my entire career, 17 years at Good Samaritan Hospital. And I see a lot of intoxications. I see a lot of complications of drug use. If you're lying on your neighbor's lawn and they can't wake you up, EMS will be called, the police will be called. You will eventually be brought to see me. You'll talk to me, and very often, like the police and EMS, I meet people on the worst days of their life. And what I've found is that in our community, it is alcohol, opiates, and cocaine that are the largest contributors to the substance abuse problem, at least the people that end up in the hospital, because these drugs make people sick. The life expectancy in the United States is dropping because of all of the young people that are dying of opiate overdoses. There are more than 200 diseases linked to alcohol use, 7 cancers. People with opiate problems end up with profound cardiac issues, infections of their valves, infections of their lung, infections of their skin, and many of them die of medical illnesses in addition to anything that they've experienced from overdosing. Not only that, but when traumas roll in from car accidents, from bicycle accidents, from falls, a lot of those people fell because they're intoxicated, or crashed their car because they're intoxicated. And our ICU is filled with people going through severe alcohol withdrawal and heart disease from opiates and heart attacks from cocaine. A lot of these trips to the hospital are actually preventable. Not everybody needs to come in because if they weren't involved in the drug, they would not have had that particular consequence. But I also see as a psychiatrist that people with serious drug involvement have mood problems, they have emotional problems, they have support problems, they have issues with their family, they have self-esteem problems, and it just leaves them that everyone in their life is a tumultuous relationship, okay? But I actually want to move this discussion slightly in a different direction, because I want to try to address those individuals that are wondering if they have a substance problem, wondering if it's time to quit, wondering if they're capable of quitting. I want to push you in the right direction. I want to encourage you that sobriety is great, because what I hear is that why should I quit? It's so much fun. All my friends are doing it. This is how I feel good. This is how I have fun. It's fun at the expense of other people. It's fun at the expense of your responsibilities. And honestly, fun does not require drugs. This is a boating town, right? We go to the beach, we go boating, we have baseball, we have all kinds of things that are plenty of fun without that. But in reality, drug abuse creates an artificial pleasure, and it's at the expense of other people. When you're intoxicated, you're much more likely to be disrespectful to those people around you. You're much more likely to act dangerously. You're likely to alienate those people around you, and you're likely to bring the attention of EMS and police, right? So users' lives are out of control, and a lot of people understand that, and everything's out of control. Their work, their relationships with others, but then they continue to use, and they do it despite understanding that there's negative consequences. So if you do something that you know is bad for you, is bad for the people around you, how's that going to make you feel? It's going to knock down your self-esteem. It's going to bring you self-hatred, self-doubt, and all of this ends up being compounded because the people around you start getting angry at you, right? They see what you're doing as self-indulgent, right? They see it as harmful to those that love you, and they end up turning away from you, and they have no choice but to turn away. They see your abuse, your continued substance abuse, as disloyalty and abandonment. They see you putting substances ahead of your obligations to your family, to your community, to yourself. So stop and ask yourself, do you really need to use drugs, right? If you become sober, your life is a lot less chaotic. You probably were spending a lot of time and effort trying to cover your tracks, right? Trying to make excuses, making up lies, trying to come up with money for the things that you did, and trying to figure out what you're going to tell your family to justify what you've done. So one of the main advantages of sobriety is your life becomes much less chaotic. It may resolve your shame, it may resolve your guilt. Your family may be happy that they can count on you again. It may allow you to rebuild your relationship, your finances, your intimacy. Maybe you'll even be more helpful to society in general. So no matter how difficult this may seem to you, it really is my advice for you to attempt sobriety. Here today you'll see many examples of organizations and programs that are useful. A couple of years ago, I made a video for the Town of Islip. If anyone is more interested in specific information on opiate abuse, you can look up that video under Islip Goes Purple, and it was called Help. So thank you to the Town of Islip for making substance abuse an important issue.
Thank you. Thank you so much, Dr. Titlebaum. It's obvious you are so very committed, and we thank you for all of your efforts. Now I'd like to introduce the director of South Oaks Hospital, a part of Northwell Health, and that is Mike Scarpelli. Mike?
Okay, thank you, Angie. Thank you to our Congressman for his kind words, and certainly thank you for Dr. Titlebaum for his service. Also want to take a moment to thank the Town of Islip Substance Abuse of Opioid Task Force for supporting this important initiative today. Fatal opioid overdoses, the majority of which are caused by fentanyl, is a serious public health epidemic, represented by about 108,000 deaths per year in the U.S. in 2021. 451 of those happened in Suffolk County residents, which is a 20% increase since COVID. It's a real problem. Narcan has been the help that has saved many, many lives to be able to make this possible to be here today. One way to combat this epidemic just a little bit further is to reduce stigma around addiction use. Making sure there's access to quality, high quality care for all of the individuals that suffer from this disease. We are proud to be able to support these individuals with the ability to begin and maintain their paths to recovery. At South Oaks, we're able to do this by understanding that it's important to not only focus on staying away from drugs, but also to promote a meaningful life. The first step is to acknowledge where you no longer want to be. The next step is moving towards where you want to go. At South Oaks, we support individuals on their path to recovery by offering a full continuum of care. We offer inpatient detoxification, inpatient rehab, intensive outpatient services, adolescent programs, healthcare professional programs, and family programs using evidence-based care. As part of the Northwell Health System, we are able to partner with other hospitals like South Shore University when individuals come to us that are too sick to be able to be cared for in our hospital. People who are struggling deserve the chance to get well and are proud to be afforded the ability to do so, and we are proud to be part of their story. And for that, I thank you for the opportunity to speak today. Thank you.
And now we're going to hear from someone who has been on the recovery journey, Cassidy Schultz from Outreach. Cassidy?
Hello, my name is Cassidy Schultz. I'm 19 and I am a resident at Outreach Adolescent Facility. I've been there coming up 6 months and I have been sober for almost 7. My sober date is February 7th, 2022. I started self-medicating for my mental health at around the age of 13. It started with just simply smoking marijuana, as it usually does, and it ended with benders off alcohol, opiates, cocaine, stimulants, anything I could get my hands on I used. And I realized I needed help, and I needed serious help. I found myself at a 28-day detox, and then I went to the town of Brentwood, Town of Islip, Outreach House 2, and they've saved my life. I couldn't express the amount of gratitude I have for them. I went in impulsive, scared, not ready to face life on life's terms and act as an adult. And at this moment in time, I feel as rational as I've ever felt. They have helped me in so many ways. They've helped me stabilize my mental health. They've helped me stabilize my life. And they have prepared me for adulthood, for beginning this long journey of recovery. So for that, I am grateful. I am grateful I'm still here, and I'm grateful I'm alive. And I'm grateful that I'm able to talk to you guys.
Thank you so much for being so brave. Thank you, Cassidy, for being so brave to share your story, your very, very positive story. And, you know, I couldn't help thinking, no matter how we pray tonight, let's say a prayer for Cassidy and everyone else who's on that road to recovery, that they continue being successful and know that there are so many people out there pulling for you. Cassidy, thank you. And to kind of wrap things up before we throw the switch and light our cupola purple, I'd like to ask Mary Ann Pfeiffer, again from YES, who is the co-chair of our task force, to come up, and Kathy Konisdorf, who actually brought the idea of Islip Goes Purple to us, to please join and wrap things up. Thank you.
I want to do a shout out to Outreach and David Vizzini, who's over here, for always supporting our efforts. And we are so lucky right here in the town of Islip to have that jewel for our young people and for coming out. I also want to give a shout out to Dorothy Johnson Knowlton, who leads the way with our International Overdose Awareness Evening. It was beautiful again. Before I bring Kathy up and she tells you a little bit about how Islip went purple, And Dorothy's also the head of Maxed Out Foundation in honor of her son, who is gone now 11 years. And Kathy is the Jake K Foundation, but she can tell you a little bit about that herself. I want to thank Good Samaritan Hospital, Northwell, and everyone who's there, my staff who did an amazing job today. Teamwork, guys, it was awesome. Thank you for getting me the most color, because that's what the boss gets for doing this to everybody. Next year, this is a color run, so if I look kind of strange, I don't even want to look at myself right now. I challenge everybody, including our elected officials, to come ready in a white shirt and shorts to have a fun run and get purple. We ran into recovery today. We're hopeful for our mental health, and we're hopeful that all of our young people and all our adults find recovery coming into the new year. Kathy?
Thank you. Good afternoon. Islip Goes Purple is a community initiative, a collective effort to work with and for everyone, our neighbors, our citizens, if we're elected officials, everybody that we come in contact with. My family is an East Islip family. We are your neighbors. Since my son's death in 2013 from an addiction to heroin, I have made it my mission to assist individuals struggling with substance use disorder and their families. I often travel the East Coast, making connections and picking up information and ideas along the way. In 2018, I was participating in a documentary and had time to walk around the sweet little town of Easton, Maryland. It's a part of Talbot County on the Delmarva Peninsula of Maryland, a very back in time kind of space. While walking around their main street, I noticed a bookstore. The window featured books on addiction and recovery with a background with purple decorations. Further down the block, a restaurant had a beautiful poster and had their limited edition for September, Recovery Month, lavender lemonade. Then I noticed the decorative banners on the streetlight poles. Talbot Goes Purple. I had no idea what this was. All I knew is it was everywhere. So I went to the all-knowing Google and I asked what was going on, and I smiled. In 2019, I was asked to join the Islip Task Force for Substance Abuse in the Opioid Crisis by Karen Sweeting, a friend of mine. I have been on other task force in other areas, and there was a lot of talk. There was a lot of talk, there was a lot of data, but I didn't see anything actually reach every member of the community. So I suggested we take this to the community level in that task force, and I brought the idea of Islip Goes Purple, IGP. It was on the table, and this wonderful team of this task force, this town, a lot of the people behind me that are involved or supportive of this, everybody ran with this. This is our 4th year, and it's gotten bigger every year. And people will come up to other people after this is over and ask questions, and that's why we're here. We have to talk about this. This is how an initiative starts, but without the community, it's just more words. Substance use disorder and or addiction, depending on how you call it, thrives in the dark, in the silence, and behind closed doors. If you live in the town of Islip, be caring and supportive. Shine your purple light. There are bulbs in all these little bags here. Everyone please take one. Tie your purple bow, also in the bags, and let your neighbors know you care. Thank you, Angie Carpenter, the town supervisor, Councilwoman Mary Kate Mullen, Youth Enrichment Services, it's a mouthful.
Yes.
Yes, say yes. Mary Ann Pfeiffer, for leading this fabulous team, for standing up, for speaking out, and the continued efforts to grow Islip Goes Purple. This is how a community initiative works. Let's celebrate recovery for the entire month of September and beyond.
So before we throw the switch, I just want to one more time thank Kathy and Dorothy particularly for taking their horrific loss and trying to make a positive difference in God knows how many lives you're touching with your initiative. So we thank you so very much. And to Cassidy also for sharing her story. Okay, so it's time. We're going to gather around the switch and light the cupola purple. And for the month of September, when driving past, we'll see it lit and hopefully remind them to join in the effort. So if the town board would come forward and everyone else gather behind them. Are we ready? Okay. Everybody grab this switch. Are our switch coordinators ready? We're soon going to find out. So we'll count down from 3, 2, 1, go. Marianne, would you just come forward and tell
And
us?
Mark?
We want to. There's a lot of exhibitors here. Tables.
I'm just
please.
going to have Mark join us. I want to quickly say that this year we had COVID. We started in 2019, and now we have a very large town. I want to give a shout out: Sayville, Brentwood, Central Islip, East Islip, Islip, Bayshore, Bayport, Blue Point. We have gone purple virtually throughout West Islip, throughout the town of Islip. I'm going to let Mark take over to tell you everything going on here today. I want to thank Mark Soto, my Director of Prevention, our Director of Prevention and Community Services. He's amazing, and Barbara Voris. They have an amazing team, but without those two, this would not be happening. It is amazing. All over the town buildings are all going to be flying their freak banner, and we're going to be proud about. We are very happy, and so thank you. But Mark, come over and tell us what you have.
So, just so that everybody understands, what we are doing here today is exactly what Cassidy stands for. That light that she shines is within all of us, and we need to celebrate that and understand that there is no stigma with substance use disorder. There is nothing to be ashamed of, and we need to promote that. So I challenge all of you here today, all of your friends, family, and community members, to stand up and show a purple bow, put up a purple light, put up a purple sign in your business. Do something to have the discussion about the fact that there is no shame in having someone in your family or in your community that has an addiction issue. These are things that can be dealt with evidence-based type of programs and all kinds of support that are supported here today, so all of our collaborators, all of our partners can make magic happen one action at a time. And we can make Cassidy an example of thousands of other young people, old people, and all community members that are suffering with this disorder. So within Youth Enrichment Services, we are providing you with purple cupcakes today, right? And we will gladly share with you purple bulbs. We will get you bows. We will get you signage. We will get you posters. And the entire month of September until September 30th, we ask that you promote this great initiative to make a difference and save all of those shining lights like Cassidy and others. So we thank you for your participation. We obviously support the town supervisor and all of our elected officials, all of our community-based organizations, and all of the leaders who come out and make a difference every day. My team, our staff is extraordinary, so I'd ask you to give them a round of applause, please, right? They are, as we say, I'm from the Bronx, so I always say they're the bomb, right? So I appreciate them, and I trust in them, and they do great work, from New York Project Hope, our Project Hope organization, to our mental health and wellness clinic, Maria and others, to our CEO, our COO, Mike, and everyone on this team is here to partner with all of you. So I ask you to just ask us for help, and we will be there for you. So come up, drink some water, get some cupcakes, get some signs, some light bulbs, and shine that purple light the same way Cassidy shines her light.
Thank you all.